our group will be presenting a research article that focuses on cardiovascular-Kidney-Metabolic or CKM syndrome, which is a recently recognized framework by the American Heart Association. So this is our group member. I'm Nur Fateha.
I'm Sheryl Green.
I'm Nur Alini.
And I'm Nur Laziati.
So CKM syndrome integrates obesity, insulin resistance, type 2 diabetes, chronic kidney disease, and cardiovascular disease into a single interconnected condition. So conventional clinical markers such as glucose, lipid panels, and EGFR usually detect risk only after organ damage has already occurred. So this article directly related to our topic because it applies metabolomics, a biochemical profiling approach to uncover early metabolic changes and hidden heterogeneity among CKM patients that are not detectable using routine clinical tests. So this is the main objectives of our research. First, to identify metabolic subtypes. Second, to associate metabolic characteristics CKM severity. And third, to explore potential biomarkers for early detection.
For the methodology overview, this was a cross-sectional study involving adults reported from a health check cohort. Fasting plasma samples were collected and analyzed using liquid mass spectrometry, which is LCMS, for both metabolomic and lipidomic profiling. A total of 390 metabolites were identified. The researchers then applied unsupervised clustering method, particularly K-mean clustering, to classify participants into metabolic subtype. And for the validation part, statistical and machine learning approaches such as OPLSDA, random forest analysis, logistic regression, and ROC analysis were used to validate the cluster and assess the ability to identify high-risk individuals. For the main result part, the study identified 3 distinct metabolic clusters. So for cluster 1, glycerol-phosphatidate enriched with generally low metabolic activity. Meanwhile, for cluster 2, fatty acid dominant with intermediate metabolic status. And lastly, for cluster 3, glycolipid enriched with the highest metabolic activity. Importantly, high-risk CKM individuals which are in stage 3 were predominantly found in cluster 3 with strong statistical significance. Additionally, a 20 metabolite lipid panel were able to distinguish high-risk CKM individuals with an AUC of 0.805 indicating high diagnostic accuracy. In conclusion, the study demonstrated that plasma metabolomics can reveal hidden metabolic heterogeneity within CKM syndrome and provide potential biomarkers that may enable earlier detection and personalized risk management.
Next part is principle of the method used. The main principle applied in this study is untargeted LCMS-based metabolomics and lipidomics. These techniques separates metabolites using liquid chromatography and identifies them based on their mass to change ratio using mass spectrometry. Unlike targeted methods, untargeted metabolomics does not focus on predefined metabolites, allowing comprehensive detection of biochemical changes across multiple metabolic pathways. The use of unsupervised clustering further allows researchers to identify natural groupings in metabolic data without prior assumptions, making it ideal for discovering novel metabolic subtypes. So for the next part is application. This research has significant benefits for society, particularly in the healthcare and clinical diagnostic industry. By identifying early metabolic disturbances, this approach can improve early detection of high-risk CKM individuals. Second, support personalized medicine, where prevention and treatment strategies are tailored to metabolic subtypes. Third, potentially reduce long-term healthcare costs by preventing severe severe cardiovascular and kidney complication. And last one, the findings are especially relevant for clinical laboratories, preventive medicine, and cardiometabolic research.
Next, we will discuss about the Deschamps study of metabolomic. So the findings are supported by a previous metabolomic study, which can strengthen the credibility of the observed metabolic pattern and also associated with the CKM syndrome. Next, metabolomic profiling can be improved with the prediction of disease such as diabetes, cardiovascular, and chronic kidney disease. The result has been externally validated using three independent data sets to demonstrate that the metabolic cluster is reproducible and consistent across different patient populations. This factor together will enhance the overall reliability and robustness of the study. For disadvantage of the study, there is a limited discussion of conflicting evidence. The study is a cross-sectional study design, which means it can be an identified association between metabolic profile and CKM risk, but it cannot establish a cause and effect relationship. Next, the cohort is from a single center with relatively small sample size, which reduces statistical power and may introduce bias. Finally, due to the population study, the finding may not be generalized to other population, ethnic group, or clinical setting.
That's all from us. Thank you.